Hi, this is Galit Goldfarb, and thank you very much for joining me here today. Today I'm going to be talking about blepharitis and other eye conditions and how dietary changes and supplements can help. Well, blepharitis is an inflammation of the eyelids that causes watery and red eyes and a burning, unpleasant sensation, itchiness, swollen eyelids, blurred vision at times, and frothy like tears, and even loss of eyelashes. Your eyelids can be stuck shut in the morning due to the crusting on your eyelashes or the lid's edges. It is estimated that 1 in every 20 people who see their doctor for an eye problem have blepharitis. Fortunately, it is not usually too serious. However, it can feel very uncomfortable, especially if you are wearing contact lenses, and it tends to recur. Blepharitis mostly develops in middle-aged people, but it can develop at any age, including in children. Aside from the already mentioned uncomfortable and painful symptoms, some patients with blepharitis also find their eyes are more sensitive to light. There are two types of blepharitis, anterior and posterior. Anterior blepharitis can be caused by a bacterial infection, staphylococcus, or a skin condition, seborrheic dermatitis. You can recognize this type when the outside front edge of your eyelids at the base of your eyelashes is affected. The posterior blepharitis happens when the glands on the inside edge of the eyelids are affected. These glands, called meibomian glands, can become irritated and inflamed, and they can produce too much meibum, an oily substance that covers and protects the surface of the eye and block them. Some patients even may be affected with both types of blepharitis simultaneously, which doctors call combination blepharitis. Fortunately, both types are not contagious. Blepharitis can often be managed by practicing good eye hygiene, but if the symptoms worsen, then the best thing is to visit your doctor for an examination. If blepharitis is caused by a bacterial infection, then it should be treated with antibiotics, either in cream, drops, ointments, or in tablet form. Blepharitis can also cause other health problems such as dry eye syndrome, infected eyelash root, conjunctivitis, and keratitis, which is inflammation of the cornea, and eyelash and eyelid damage. Now, the dietary changes can be of help. Adjusting your diet to ensure it includes all of the crucial and necessary nutrients for good eye health is essential. Since oxidation and inflammation are implicated in the etiology of these many eye diseases, antioxidant-rich foods and anti-inflammatory foods will provide benefit in decreasing the risk of eye disease. The eye has a particularly high metabolic rate, so it needs higher antioxidant protection. Nutrients of particular benefit include vitamins C and E, and the carotenoids beta-carotene, lutein, and zeaxanthin. Lutein and zeaxanthin act as antioxidants and limit eye oxidative damage by absorbing incoming blue light and quenching reactive oxygen species, free radicals. The eye is highly concentrated in fatty acids, therefore omega-3 fatty acids are very important. And zinc is also of major importance as it is needed for optimal metabolism in the eye and plays an important role in antioxidant and immune function. Vitamin B2, riboflavin, also contributes to the maintenance of normal vision and healthy eyes. For vitamin A, as beta-carotene, a recommended dose involves 15 milligrams per day that can be taken through sweet potatoes, pumpkins, carrots, cooked or raw. Both have high levels of beta-carotene. Winter squash, peppers, kale, and spinach. For vitamin C, a recommended dose involves 450 to 500 milligrams per day that can be taken through blackberries, blueberries, strawberries, all the berries basically, raw broccoli, oranges and orange juice, grapefruits and grapefruit juice, as well as Brussels sprouts. For vitamin E, a recommended daily dose involves 400 IU, international units per day, that can be taken through almonds, peanuts, wheat-germ, and sunflower seeds. If you do not consume these foods, then I definitely recommend taking supplements. For zinc, a recommended dose involves about 15 milligrams per day. that can be taken through chickpeas, beans, almonds, and cashews. Please note that zinc absorption is lower in people on vegetarian and vegan diets. Therefore, it is recommended that people in these groups consume twice as much as non-vegetarians. The carotenoids, lutein and zeaxanthin, have no recommended daily requirements and can be taken through spinach, kale, broccoli, sweet corn, peas, and Brussels sprouts. For omega-3 fatty acids, also there is no recommended daily dose, and can be taken through chia, flax seeds, and as well as walnuts and fatty fish. For vitamin B2, riboflavin, recommended dose involves 10 to 25 milligrams per day that can be taken through almonds, mushrooms, sesame seeds, and spinach, or taking a B complex vitamin. Overall, an anti-inflammatory healthy diet that provides lots of vitamins, minerals, fiber, and fatty acids is advised. This diet includes whole grains, vegetables, fresh fruits, increased water intake, very important as well, nuts and seeds. Now, foods and beverages that you want to avoid include saturated and trans fats, cheese and dairy products, refined grains and sugar, alcohol intake, fructose, margarine, and processed foods. Supplements that can help with blepharitis. If you think that your vitamins C, E, B2 and carotenoid levels for beta-carotene, lutein, and zeaxanthin are low, or your zinc or omega-3 intake is insufficient through your diet, then you should consider taking dietary supplements for these nutrients. A recent clinical trial suggested that omega-3 fatty acid supplements can be beneficial not just for blepharitis, but also for meibomian gland dysfunction. Cataracts and age-related macular degeneration, characterized by degenerative changes within the macula and central area of the retina that is responsible for high-resolution vision in people aged 55 and older. Macular degeneration is the leading cause of severe vision loss and vision impairment, especially in European populations, people that are coming from Europe. Cataract is defined as any visible opacity within the otherwise clear crystalline lens of the eye. Now, oxidation reactions within the lens are thought to be a key factor in this pathogenesis of cataracts and age-related macular degeneration. Therefore, the same recommendations that are beneficial for blepharitis are also helpful at preventing cataracts and delaying age-related macular degeneration. So, all in all, a healthier, antioxidant-rich, anti-inflammatory diet with supportive supplements when needed, and an overall healthy lifestyle involving no smoking, smoking cessation, will certainly help keep blepharitis at bay, as well as any other eye conditions, including cataracts and macular degeneration. These guidelines will also help you maintain good eye health and good vision in later years. I hope you liked this video. If you did, please give it a thumbs up. Please also subscribe to my channel and ring the notifications button. If you like these types of videos, you can subscribe to this playlist of health videos. Also, please visit my website, thegorilladiet.com, for any help supporting your health and wellness. Thank you very much for joining me.